For our four panelists, thank you for those extraordinary stories and for bringing the realities for many to life. We heard themes such as fear and mixed emotions, setting and breaking boundaries, as well as experiencing the reward of being of service to others. We heard about risk and support systems and spiritual life, hope and grief. And yet we talk about success stories. So let's hold on to that. We would like to take a few minutes now to ask our panelists some questions. And so this is for Brian, our COVID survivor. What lessons did you learn about your experience as a COVID survivor?
Yes, Trish. What I've learned throughout my experience is how dangerous this virus is. I've realized that life is precious and we can lose it easily. I know to respect this virus, and I am as vulnerable as anyone else. And I also understand how it feels to be like a patient and how I appreciate the people whose job is to save lives. But most of all, the important learning experience that I have here is how I cherish every single moment with my family and loved ones, that I have to treasure it more than I did before, now that I have the second chance to do that. So that's all. Thank you.
That's amazing. And so we save each other's lives. And so for the frontliners who saved Brian's life, and Brian now is saving his life by doing the right thing and taking care of himself.
Okay.
For Lozel, Tina, and Brian, again, what is your advice to all the frontliners during this pandemic? Let's start with Lozel.
Thank you, Trishia. I think the most important here is to really be patient. Be patient with yourself. Be patient with others that are also going through this. We have naturally to be reacting to unexpected situation. And so it's important for all of us. And I think, as I mentioned in my narrative, you know, we're as vulnerable as everybody else, and really to be patient with yourself and others, because we're treading water. As we tread water, you need to not panic and also take a breath and take care of yourself.
Very good. And that's very helpful to us all. What about you, Tina? What advice would you give to frontliners during this pandemic?
Well, the transition that I had was very kind of difficult, because coming from the vascular team, and then I was given less than 24 hours that I was getting redeployed to the COVID ICU. It was really overwhelming. Like I didn't have any words. I was crying for days. I took courage from my husband, but as soon as I shifted my gear back, I walked into the ICU. And, you know, I said to myself, and I've always learned throughout my nursing career, that there's no emergency in a pandemic. You have to save yourself to be able to save someone else and take care of your patient. You know, I go into the room and take care of this patient. And when I leave the room, it's okay to be, you know, I learned how to be more vulnerable. I have to take care of myself, drink some water. So, you know, for us frontliners, you have to take care of yourself so that we'll be able to take care of our patients.
Yes. And so what about you, Brian? You're a frontliner, and as well as a patient, you've seen both sides.
Yes, that's right. Yeah. For me, in my opinion, as a healthcare provider, I know that it is hard to be in that position, especially for our nurses and our doctors. So I feel that in this desperate moment, in this global pandemic, that they play the most important role. And for me as a patient, I felt that they're the only people whom we can rely on, and we can hang on for our survival as well. So my advice is just very simple. Like, I think we just have to continue with what we do in saving lives, and at the same time, practice more protective measure, continue to use your PPEs, protective equipments, follow all the protocols and guidelines, because I still believe that this method is still effective from preventing us from getting sick as well. And lastly, we'll just be positive that someday there will be a cure for this.
Great, thank you so much. You know, what we heard is we have to have patience for ourselves, others, and for imperfect protocols as we learn day to day. And we cope and we shift gears, as Cristina said. And so we become nimble, technically and scientifically, and at the same time be vulnerable while learning and trying to help others. And what did somebody say earlier? I think it was Cristina that said, you know, there's no emergency in a pandemic. And so this is a marathon, not a sprint. And so we give ourselves time. There's a question in our panel here, for our panelists here, and I'd like to ask Dr. C. What do you do to cope mentally, physically, emotionally at this time, during this stressful time of the virus?
Well, that's a good question, Trisha. And so we are in uncharted waters, and there's a lot of uncertainty currently. But how to keep one physically, mentally, and emotionally fit during these challenging times? What I would suggest is first stay home, and from home there's a lot of things that we can do. I actually would go on look at social media, wherein there's a lot of folks sharing exercise routines, or usually I do workouts with friends like P90X. We work out together, we motivate each other. Emotionally, I have a simple answer. Though I cannot be physically next to family and friends, I reconnect through FaceTime or video chat. Mentally, would recommend meditating. What I've done is watch nature documentaries such as Our Planet on Netflix with David Attenborough, or BBC's Blue Planet. So it's a way to connect to Mother Nature, relax, meditate, and it'll give us a pause from a lot of the constant bombardment from the news, whether it's good or bad. But I think that's a nice way for me to just relax.
Thank you, Dr. C. And as we've heard from you and the other panelists, there's a symbiotic relationship here. We listen to protocols and trust our health officials. And so we take care of our patients and we take care of ourselves. So we take care of ourselves so we can take care of our patients. So wear the mask, don't touch your face, so we can help flatten the curve. We have another question from our audience. How contagious is the virus, and are there a lot of colleagues in your work area that got sick? So maybe we can ask one of the panelists, Cristina, to answer this question.
Sure. Yes, I've known a lot of my colleagues, some are not directly on my department, but some nurses and ancillary workers are actually got the virus. So yes, it's very contagious. I think, you know, we're not sure yet, you know, it's all uncertainty if we got it at the hospital or we got it in the community. So, you know, we just have to take our you know, ourselves. So some of them had like took a leave of absence. So that's another part that we're kind of short staffed during that time.
So Dr. C, can you answer that question briefly?
From our institution, there's several of my colleagues who had symptoms, but when they got tested, it came back negative. We are all aware that the sensitivity of the test is not that great. Some say it's 60%. So if there are 10 patients who are positive, only 6 would come out to really be positive on the test. So some repeat testing is required. So it's likely that there's a lot more out there who are positive. So when we speak of symptoms, that alone would make one isolate, even if it comes back negative, until one is symptom-free. How contagious? We all know it spread throughout the world, so that alone is a sign of how easy it spreads, because what we've learned right now is that you can be contagious even without any symptoms at all. So that's the challenging part, is to isolate those who are symptomatic as well as those who are who has a, shedding the virus.
Yeah.